We are here with Willeke van Staalduinen. It's from Academy. It's our partner from the SIRENE project. And today we will talk about defining impact. So how can we define impact related to social innovation and social innovation actors? Willeke, the floor is yours.
Thank you very much, Dimitris, for presenting and opening the session. Yes, I would like to speak about how to define impact, where the results of investigations of a long time ago. I'm Willeke van Staalduinen. I'm the CEO of Academy and also partner in the SIRENE project. But exactly why do we have impact, and what is it and why is it? And I hope to make it more clear during this webinar. The most important thing is that if there is no impact of projects, then there is also that means that then there is no results, because every project needs to have impact, otherwise it is not there. So impact is the strong effect that something has on a situation, on a person, and this is influenced by the actions that are taken into a project. An impact-driven approach is always necessary to ensure that the results of funded projects, like Horizon projects or Erasmus Plus projects, do not remain on shelves or in drawers, but that they are used in the future. This means no use is no impact. That is for sure. The Dutch National Authority of the Erasmus Plus developed some years ago the so-called impact tool for Erasmus Plus projects. This is a very helpful tool to already define the impacts, but also to see what is exactly impact if you see in the whole line of the projects. For instance, it is important to start with the desired impact. Desired impact is something that lays beyond the project. For instance, you can think of, I want to make the population a bit healthier and happier. And that is often because projects are longing for sometimes 2 or 3 years. That is something that you cannot achieve during the lifetime of the project. But that is something that is the road to, that you indicate with the desired impact, the road to more happy or more healthy populations, for example. To measure the outcomes of the projects, that are the expected impact. For instance, that you have as an outcome defined that the population in a certain area has less visits to the general practitioner because they feel more healthy and happy. That is one of the outcomes that you can have of one project, and that is the so-called expected impact. The output, that is the deliverables of a project, and of course the activities is how you work on to produce the output, and the input is all the resources that you put in. For instance, your workers, the capital, the networks, other research. That is all the inputs that you can use. And you can, if you go through to the link that is presented here, then you can also check and see the questions that are asked to define the impact itself. In 2015, the so-called project AFV InnovNet produced the so-called SEEIT. That was the social, economic, environmental impact tool based on the results of the age-friendly environments. Because we are now talking within SIRENE on smart, healthy age-friendly environments, we thought it is a very good match to test the SEEIT and to revisit it and to make it appropriate for the smart, healthy, age-friendly environments. So the impact assessment is regarding the smart, inclusive, healthy environments, and that can be one of the part of the SHAFE practices and SHAFE policies, that these can be assessed on making impacts. Who are we addressing in this smart, healthy, age-friendly environments? That is the citizens of all ages in a society for all. And where do we focus on with the smart, healthy, age-friendly environments impact assessment? That can be on neighborhood level, but it can also be on local municipality level or even national levels. And when do we assess these the smart, healthy, age-friendly environments impacts? That is, for instance, if you have a program or you want to develop a policy or a project, that can always be assessed in several ways. The See It Revisited makes use of a cycle of impact assessments. It starts with defining the aim. What is the core problem and aim and objectives? For instance, if you have a neighborhood that has where the population is developing a lot of obese outlooks, so that you can have also this core problem, and that is one of the core problems, how to reduce the number of people with obesity. And then that is what you define in the scope, is you make an baseline assessment, how many people, for instance, are obese in the neighborhood. And then you also define some solutions, for instance, more walkable areas or more healthy food provisions, etc. And then based on these solutions, you make the assessments and the analysis, and finally present the results to the one who is asking for the assessment. So the steps of the See It is that you need to start with the creation of an assessment team. That is, you can always do an impact assessment sitting behind your desk, but also to raise awareness for the possible solutions, and to also involve people that are necessary for the approval and also the success of a project or an initiative. Then it's always good to have a team that is performing the assessment, and make sure that the team is diverse, that is consists of citizens and multidisciplinary science, and also, of course, gender balance and diversity balance. Then you define the aim and the scope of the assessment. What is the outcomes that we want to achieve, and what is the exact area in which we perform the assessment? Is it a neighborhood, or is it broader? And then you start with the identification of the key relevant impact domains. These are the possible impact domains, like we have divided them into social impacts. And then you can think of the sub-areas of health and longevity. And if you have the impact for considerations, that can be, for instance, the life and health expectancy, the life expectancy, but also the healthy life years, the number of physical activity that is performed, or the number of chronic diseases in the area, the number of falls or mobility. And you can also think of, for instance, of the education and lifelong learning is one of the social impacts that we want to assess. And that is for instance, taking care of the literacy, the educational attainments, and the lifelong learning opportunities. This is schedules that are available to assess and to ensure. The economic impacts that can be assessed is, for instance, the standards of living, or the economic prosperity, or the innovation and research and development investments, or intellectual property. These are all the fields that you can assess in the economic impact field. And the final is the possible environmental impacts, and that is for instance, the land use, or the climate and energy saving, or the conservation, the use of or reuse of resources, and the number of houses, like the accessibility of houses, or the number of gardens, heating, water, drainage, etc. With the team, you check this whole list of social, economic, and environmental impacts, and then you define which sub-impacts the domains are relevant for this assessment exercise. And then per impact, you define the direction. Is the direction of one of the, for instance, for the longevity, is the direction of the proposed solution? Is it negative or neutral, positive? Then you can also tick the boxes on what are the directions of this. Also, you need to define with the group, what is the intensity? Is there a strong impact, or is it neutral, or is it very strong? That is also what you need to define. Then you define who or what is impacted. What is exactly the what is that, who is it the citizens only, or is it the healthcare sector, or is it the businesses in an area? So you need to define that. Then also, because that is very relevant, what often comes back in horizon proposals is the scale and significance. Ask that. And the scale is how widespread the outcomes and impacts are likely to be. For instance, if you think of measures to improve the workplace environments of all the workers, what is the and that is the scale, and then you can define what is the percentage of all the workers in the workforce, and then you can see if we take measures, then this is the whole scale that you address. The significance, however, is not addressing all the older workers, but only, for instance, the older workers that are at risk of having falls or invalidity or with working in these situations. So that is the definition that you can take into account if you look at the scale and significance. Scale is the whole population that you want to address. Significance is the importance of, especially who is affected. You can also check on the quantification and monetization of impacts. As I said, the scale and the significance are already there, but you can also check on the monetization of non-market impacts. For instance, that you link specific solutions to the market prices that are there, or such as the decrease of hospital admissions, so that you can see, okay, if we reduce the number of hospital admissions with, you can define how much euros it will deliver. You can also check on the timing and sensitivity and incremental considerations, and that is also how can you divide the term of the impact? Is it a short-term impact, or is it longer-term impact that you can always define? Then you have the impact assessment on the costs and the setup. That is, for instance, the setup, operational costs, and administrative burden of certain solutions, or the gains and the losses. To continue with the quantitative analysis, then you can make non-monetary approaches. For instance, that you define what the solution leads to the improvement of the quality adjusted life years, or it also can be on the other way around, the disability adjusted life years, if we do, for instance, nothing. That is the counted as years lost. And you can also work on the healthy life years. That is also one of measures the numbers of quality adjusted remaining life years per person. Then you have the monetary approaches, for instance, the costs of illness or the human capital. And if you have, for instance, a measure that the eventual loss of future earnings, that can also be included in the assessment. Preference-based approaches is the value of statistical life. That is the value on willingness to accept higher or lower levels of risk, and the value of statistical life year, increase of one additional year of life expectancy. That doesn't say anything about if it is life expectancy, if that's also healthy life expectancy improved. You can finally assess in the quantitative analysis is the life cycle assessment approach, and that is, for instance, if you look at the environment, that if there is what is the result of the project and service is doing on the environment, and if there is also measure of cradle to grave. The fourth step of the see it, revisit is the analysis of the findings. If you have the whole overview of all the directions, the intensity, and the monetary or the financial or the quantity of the impact assessment, then you can in the group define what is our expected outcomes in the overall of the impact assessments, and this can be presented to the results to the public or the decision makers of finally approving the proposals. To read more, we have written an article that is published on Zenodo, and here you can find the article that you can download for free in the social, economic, and environmental impacts, and also more explanations and links to the different calculation methods are available in that way. And that is the end of my presentation. So I would like very much to thank you for your attention, and looking forward to any questions or what you have.
Thank you very much, Willeke. Just to remind that this webinar will be available on the SIRENE project website, and of course we'll also include there the paper you referred to from Zenodo, so that people can refer to it for more information.
Yes, thank
Thanks
you.
again.
Thank you very much. Bye-bye.